Hi guys, so today I thought I would jump in here and talk about 5 reasons why microbiome poo testing is a complete waste of time and money. I keep coming across people ignoring that they are bleeding and they're finding blood in their poo, which is never a good thing. And then they're going ahead and then asking for dietary advice, ignoring the blood. So I just wanted to jump in here and just talk a bit about this. So there are two different types of poo testing, I guess you could say. So there's the good type, in my opinion, and then there's the bad type, which is the microbiome testing. So the good is if you experience blood in your poo, like if you're wiping yourself. I know this sounds minging, but this is important to talk about. And the sooner the doctor knows about this, can investigate, the sooner you can get the right treatment. And if it is cancer, the greater chance of survival. So it's super important to talk about these things, even if it sounds minging and it's embarrassing. So the good testing is going to your doctor and then taking a stool sample, a poo sample, and they can test it for various things depending on what you've told them. So it might be that you've got, say, classic IBS symptoms, so whether it's diarrhea, constipation, pain, wind, bloating, all those kinds of things. And instead of trying to self-diagnose yourself with IBS, you could go and get investigated. So you go to your doctor, then they could, depending on your age as well, like if you're over 50 as well, the more likely is to want to do hammer up your bum, so colonoscopy, and have a look, see what's going on, see if there's anything there. And they might also want to do a poo sample, and especially if you've got family history of inflammatory bowel disease, which is Crohn's disease and ulcerative colitis, for example. So they can take a poo sample and then they can test it. So they can test it for inflammatory markers, which would then suggest whether it's cancer or inflammatory bowel disease, but they won't be able to take that test result on its own. They'll need to talk to you about your symptoms, how long it's been going on, what's been going on. They want to take some blood. So they build up a picture of everything that's going on to then come up with a diagnosis and then give you the right treatment. They can also test it for blood. So they can be obvious blood, it could be bright red blood that's on the poo. So that's like fresh blood. If your poo is darker, then it can suggest maybe you're taking iron supplements, or it could be the food that you're eating, it could be medications that you're taking, but it could also be a sign of blood, so it's further up in the gut, so you're bleeding further up. If you cut or graze your hand, or like as a kid, you graze your knees and then you get like a dark scab form. Well, that's basically the same, but it's in your gut, so then that will be causing the poo to look darker. And they can also test and look for certain nutrients, and also if you say like your poo is floating, it doesn't flush, if it's pale, then they can also investigate that to see if there's any malabsorption. So basically your body isn't absorbing the nutrients, so basically the nutrients are just going through the system, and it could be like the fats aren't getting absorbed, so they're just going through the system, and then like oil and water or fats and water, the fat will rise to the top and they'll sit on the top. So that's the good side, poo testing. Whereas in my opinion, the bad side is for microbiome testing, which is to test for your health. People are having it done to try and identify triggers for their IBS or other gut conditions. So far, the science isn't there yet, so we don't know what a healthy gut looks like. We don't know all about everything that's living in our gut. There's lots of microorganisms and things that are living in there that we don't even know about. So the first one, so there's errors that can rise. So there's flaws and limitations from all the way from taking a sample all the way through to analysing the sample and giving you the results. So if you do a home test, it can be nice because you're doing it in the comfort of your own home versus going to the doctors and then having to try and put it in a little bottle and then being embarrassed and handing it over to your nurse or the doctor to, send it off for testing. So it can be better if you do a home test kit, but then with home test kit, it depends on the quality of the company and the quality of the technology and equipment that they use to test these samples. So You can introduce errors yourself by contaminating the sample, by not packaging the sample up properly, all the way through to getting it tested and analysed and then getting the results. When you get the results, you could misunderstand the results. You could freak out, which is never very helpful, especially when you've got no one to talk to about the result, because you do the test, a home test kit, you do the test, typically, you'll get the results. They will say, list everything that's wrong, and maybe there's a few good points, and then they'll probably suggest that you buy their supplements. They might even suggest a dietary regime for you to follow. You might get a nutritionist, but a nutritionist is different from a dietitian and even a doctor. Normally you're kind of left on your own, so you could get freaked out by the results. They could give you the wrong advice. They're just literally just looking at that sample, and it's just a snapshot of that moment in time. And then they can sell you unnecessary supplements that you might not even need. So there's problems with the techniques, the equipment, how to take the sample, the storage of the sample, the analysis. So there's loads of different flaws with these testing. And then number 2, there's so much more to learn. I've already mentioned about this. So quite a relatively new area of research. We need scientists to research this, so then they can find out more, and then that can get passed on to the medical world, and then that can improve the medical world treatment and diagnosis and understanding our bodies, our health, and how medications work, and the whole host of different things. So there is a lot more to learn, and we need scientists to research this. But for home test kits and for your own, working out whether you've got a healthy gut or not, it's pointless really, because we don't know enough. Number 3, the poo doesn't contain all of the microorganisms, all of the bacteria, everything that's living in your gut. That's because the poo is stored in the rectum. So just before you evacuate it, you go and have a poo, it's stored in the rectum. And so the poo is more likely to reflect that area of the gut versus anywhere else in the gut, because it has to travel all that distance through the system. Things will get lost, and also bacteria stick to the line, certain bacteria stick to the lining of the gut. There's also bacteria and microorganisms that we don't know about. So then how can you test them and analyze for something that you don't know about? So it's more likely to represent that area of the bowel. So base dietary recommendations and your health on your poo results isn't really going to be very good. So point number 4, factors like your lifestyle, your life stage, whether you have a disease, any health conditions, how stressed you are, your level of sleep, exercise, what medications you're on, your diet, if I haven't already said that. These factors can all influence your gut bacteria, your gut microbiome. One little test is just going to be a snapshot of that moment in time, not of everything that's going on over a period of time. So you'd have to have loads of different tests, but they don't even know how frequently you would have to have the tests done. And these tests can be like a few £100 upwards, really, as much as you want to spend. And then obviously factoring in how often you would have it done, whether it was weekly, monthly, every few months. They don't know the best timescale for that. Doctors, when they are doing tests to see the activity of a disease, so like if you've got Crohn's disease, they might want to take several poo samples to see the levels of inflammatory markers that are in the poo. So they might want to take several, but there's research and scientific evidence behind them doing that with microbiome testing and trying to find out how healthy you are, or identify what triggers, or what's causing you to have diarrhea or gut problems. They don't know yet. So having one test is just going to be a snapshot of that moment in time. And as I said, so number 5, there's too many unknowns. We don't know what we don't know. So at the moment, it's early days, so pointless having this test done. I mean, of course you can, if you're interested and curious about what your gut bacteria is like, for basing, dietary recommendations, you might as well Google it to see what things you can do to try and make you have a healthier gut. But obviously be careful of where you go to get your information. Make sure it's from a reputable source. So the key takeaways are experiencing a change in bowel habits, if you have blood in your poo, and remember you can't always see the blood in your poo. They call it occult blood, so you can't notice it. It can't be detected by the naked eye, so they have to use technology and equipment to identify that. So if you have got a change in bowels, you are bleeding, maybe you're feeling tired as well, maybe having a constant pain in your tummy, maybe you felt a lump somewhere down there as well. If you've had weight loss, then these are all signs and symptoms that something else could be going on. Bleeding is never from IBS. IBS doesn't directly cause bleeding from your bum. It could be that you have constipation, which causes you to strain, which causes you to have piles or hemorrhoids, or causes a tear, which can obviously make you bleed. But directly, IBS doesn't cause you to bleed, and bleeding isn't normal. So yeah, I highly recommend you go to your doctor about that. And if you have those other symptoms that I mentioned, tiredness, or constant pain, whereas with pain with IBS, it can move around. Some days you might have it, sometimes you might not. If it was cancer perhaps, but also other conditions as well, it could be more of a constant pain, but always speak to your doctor about this. Get tested if you want your microbiome tested and you're curious, you can, but I wouldn't expect to get much benefit from it for your health or IBS. If you want a healthy gut, make sure you're getting plenty of sleep, manage any stress, exercise. You can eat whole grains, but obviously if you've got IBS, then you need to be wary of what you're having, so identifying your triggers, but eat whole grains and healthy fiber that you can tolerate. Loads of fruits and vegetables, obviously within your limitations of tolerances for your IBS, making sure you're having plenty of fluids, not smoking, that kind of thing can all be beneficial for your gut bacteria, and you don't need a poo test to help you identify that. If you have any questions or any comments, please feel free to get in touch. I hope you find this helpful. Good luck with everything and take care. Speak soon.